the virus that's circulating, what our immunity levels to the virus are, and also our behaviors. So we know that all our restrictions and protections are essentially gone related to COVID. So there's more COVID in circulation, but our immunity to infection has also declined. So we had big waves over last Christmas, and we had a big wave in the winter. Well, our immunity from those waves, as well as from our vaccination, is now in decline in terms of getting it. So we're more susceptible to it. So now we're getting it. Now, our immunity to hospitalizations, our protection from hospitalizations and from dying of the virus still is high. But the more people get it, the more people are at risk of those outcomes. And we're seeing that play out in the number of people going into hospital.
How does this wave compare to previous ones here in Australia?
Well, it's getting up there. We had a very bad wave in the summer where we had many thousands of hospitalizations, but we're now up to 3,000 hospitalizations for this wave, and it isn't finished peaking in terms of hospitalization. Unfortunately, we're going to be seeing that around the Christmas time. So there's going to be a lot of pressure on the hospital system right at Christmas time. When you think about the number of people who have COVID last week, over 100,000 people actually had COVID positive test, and we know that there is low reporting of tests and decrease in testing. So we think that 5 to 10 times that number of people actually had COVID. And I'm sure your listeners are seeing people in their communities get COVID, sometimes for the first time, many times for the second time. So we think probably at least 1 in 50 Australians to 1 in 25 Australians currently have COVID. So that's a lot of COVID in circulation, and it's peaking in the next week or two, which means there are going to be a lot of cases at Christmas when people are wanting to get together. So there's a lot of risk at that Christmas table.
Given that, and as you said, our immunity has declined, should there have been a push over the last few months, over the springtime, for people to be getting boosters? Because there hasn't been a big health push, has there?
There hasn't, and I'm glad you brought that up because that's a shame. I think that what's important is anyone out there that's not up to date with the vaccination, they haven't had all the vaccines they can, there's still time to get vaccinated and get protected for Christmas. And that's actually most Australians. So we know close to a quarter of Australians have not had their third dose, and that's really important to do because that is a game changer. And then we know that of eligible people for that fourth dose, most have not received it. So for majority of Australians, you can go into a pharmacy and get boosted tomorrow to make sure you're as protected as possible for Christmas. And there is still time so that over Christmas you have that protection to not just protect yourself, but also to protect your family. So I think that that's really important.
Do you think that there should be restrictions brought back, like masks in indoor places or any of the other restrictions that we have seen in the past, or should we just ride this wave?
Well, I know that what is clear is that without mask mandates, people don't wear masks. So even people that want to wear masks, there's a lot of social pressure to not wear masks if the mandate's not in place. So I think a mandate would definitely help, and masks definitely help in terms of reducing transmission. That's not going to happen, so I think we just need to accept that and move on. Would masks help reduce hospitalization and deaths from COVID? Yes, it would, but we don't seem to be willing to do that. So I think what people need to think about right now is what's best for themselves and for their families. And remember, at Christmas time, it's a mixing of family members, so it's a mixing of age groups. So that means a mixing of the risks of COVID.